Bismillahirrahmanirrahim. Assalamu alaikum. I welcome all the audience from different parts of the world to today's webinar being brought to you by Imamia Medics International Women's Wing, South Central New Jersey chapter. You are watching us live on my TV, the YouTube page of Imamia Medics International. My name is Varda Batul and I'm part of the Women's Wing team. We will begin today's webinar with the recitation of holy verses. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم قل هو الله أحد الله الصمد لم يلد ولم يولد ولم يكن له كفوا أحد. Translation. Say He's Allah the One. Allah is eternal and absolute. None is born of Him, and nor He was born, and there is none like Him. Sadaqallahul Aliyyul Azim. Once again, I welcome all the audience, and you are watching us live on my TV. The South Central and New Jersey chapter has prepared a lot for this webinar, and they have brought for you a very important topic, which is colon cancer and your gut health. And I will be introducing the moderator for today's webinar, that is Dr. Hadika Batul. Dr. Hadika Batul is a board-certified internal medicine and focused practice of hospital medicine physician with experience in academic hospital medicine, including bedside teaching, consultative medicine, along with academic and non-academic realm. Her career outshine as being a teaching faculty at Hospital of University of Pennsylvania and conducted QI safety projects along with utilization reviews for recurrent hospitalizations. She has a special interest in teaching point of care ultrasound at bedside. She is active member of Society of Hospital Medicine and American College of Physicians and also working with American Association of Physician Leadership. She is also the Director of Education at Sogra Get Well Clinic, project of IMI Global Network of Get Well Clinics. I welcome you, Dr. Hadika Batul, and thank you for bringing this webinar to us.
Thank you, Ada, for this kind introduction and coordinating this webinar. Welcome my listeners and viewers from US and all over the world. Grab a cup of your favorite beverages and join us for a discussion on a very important topic, colon cancer and your gut health. Colon cancer, as you know, is the most common type of gastrointestinal cancer, which is a multifactorial disease with etiology affected by genetic factors, environmental exposures, including diet, and yes, lifestyle changes can save life. So let's welcome our speaker for today, Dr. Farah Kasamali. Dr. Kasamali is board-certified gastroenterologist trained at UCSF Health, St. Mary Hospital, San Francisco. Her fellowship from California Pacific Medical Center, and from Bay Area, she moved to New Jersey Garden State and currently doing her advanced endoscopic fellowship at Hackensack Meridian Health. She has actively volunteered in community events and driven by passion for serving underserved population and preventive health. So I welcome our speaker, Dr. Kasamali.
Thank you so much. Assalamu alaikum to everyone who's watching. Really appreciate IMI inviting me, and I'm happy to get to know at least some of the community members and inshallah in the future more. So wanted to start off and just mention, talk about colon cancer screening, why that's important, and how you can also help in decreasing your risk for that. So next slide. First, I think what's most important is to talk about what colon cancer is. It is actually the third most common cancers in the US for both men and female. Of course, it's affected in other countries, but at least the census from the United States, this is the third most common. It's important because it is preventable, and you can't say that about many cancers, but this one is a preventable one. And we'll talk about how and how to achieve that. One thing that I did want to kind of mention is certain symptoms that patients may come in with. It doesn't necessarily mean they have colon cancer, but this is something that is of concern even to doctors. And so if you ever have symptoms like blood in your stool, weight loss, or change in your bowel habits, which means, of course, diet, travel, if you're sick, things like that can change your bowel habits. But sometimes if it's been months and you used to have normal bowel movements and now it's becoming skinnier or something has changed, then these are some symptoms that you do want to come and speak to your doctor about. But this is more of a side note, because when we're talking about screening, colon cancer screening happens regardless of whether you have symptoms or not. So that's an important takeaway. But I just wanted to let you know some concerning symptoms that should prompt you to go to see your doctor. Next slide. So we talked about what colon cancer is, and I will talk a little bit more about that in the future slides. But who needs to get screened for colon cancer? And it's everybody. So like I mentioned, you don't need symptoms. All you need to be is a certain age. And in the past, that age used to be 50. But what we have seen through research over the last several years is the amount of colon cancer being seen is increasing, especially in young adults. So a lot of our guidelines have changed to adapt to that, and the new age for you to get screened is 45. So, anyone who becomes age 45, you need to go talk to your doctor and get some sort of screening test. The reason why the rate of colon cancer has increased, it's not entirely sure. Some theories are that the young adults nowadays are more open to going to visit the doctor. If they have certain symptoms, they'll go and get checked out sooner. Other things are some of the tools that we have are better in terms of technology. So maybe we're detecting more in that sense. But regardless, other, diet, environment, those things we're not really too sure of. But what we do know is the rate's increasing, so it's important to come age 45, get your screening. The other caveat is if you have family history of colon cancer, that's a whole separate category that you are in, and so you would need a sooner colonoscopy. What's important to know in that regard is you should know the age of that family member when they were diagnosed with colon cancer, who the family member is, meaning was it an aunt, was it a sister, was it a cousin? So a lot of times, if you have some sort of suspicion that someone in your family had it, when you go talk to the doctor, they'll ask you details. And if it's, for example, if it's a young, your sibling, they were young, yes, you for sure need a screening earlier. But if it was maybe one distant cousin, that's about it. They were in their 70s, 80s, then you may not need a sooner colonoscopy or screening test. So just some things to be aware of. Next slide. So going into why this is important, why we need to do screening for colon cancer. This photo shows the inside of your colon. And then colon, you may also, large intestine and colon are the same thing. So you've probably heard of that too. What you see in this photo is there's a camera, that black tube is a camera. And then there's a polyp. So that thing that's hanging, that's a polyp. And the reason you need to do screening is because sometimes you may develop polyps. You don't necessarily have to have symptoms, but that can develop in your colon. And if they progress, years down the line, that could lead to cancer. So the reading screening is important because you can reduce your risk significantly if you're on this screening program. What a GI doctor can do is go in, remove the polyp so that you don't have to worry about the polyp becoming cancer. So that's one of the main things. You want to we easily can prevent it with all the tools that we have. Next slide. Okay, so we talked about what it is, who should get screened, why that's important. The biggest thing is how can we screen? So we talked about a little bit about the colonoscopy, which I mentioned the camera test. So you can see in the top right photo, you have that black camera. You go up from your rectum into the left colon, the middle of the colon, and the right colon. So the entire colon you can visualize through that camera, and you can look for things like those polyps. So that's one method. And you can also see there's a doctor that's performing it. You're asleep, so you have anesthesia or sedation, and you're going to be lying on your side for the procedure. What about other methods? So other methods are stool tests, so the bottom two pictures that you can see. There's different types. It's a bit more detailed, but what some people like about the stool test are that it's a little easier. So if you're hesitant about a colonoscopy, sometimes you may choose to do the stool test because it can get mailed to you. You just make sure, it's your proper identification. You need to know how to follow instructions. So that's one thing. And then you give a stool sample and then you just mail it back. So it's really easy. So some people like that. The only thing is, if you do end up doing this test and if it becomes positive, meaning it's looking for blood specific to human DNA. So if it becomes positive, then you have to go to step 2, which is colonoscopy, because colonoscopy is the best test we have. It's not 100%, but it's the best that we have. So that's one disadvantage of a stool test. If it's positive, you have to go to colonoscopy anyway. And then the other maybe disadvantage, but maybe you don't mind about a stool test is, say if you do, depending on which one, you do it one time, you're negative, then you may not have to do it, or you may have to do it sooner than a colonoscopy. So sometimes within 1 year, or you have to keep doing it every 3 years. So that's a little caveat to that. Versus colonoscopy, say you did that, it's a one time thing. If you have no polyps, then you don't come back till 10 years. So you can gain a bit more years until you have to screen. But sometimes if you find polyps, then you may have to come back in a certain amount of time, 3 years, 5 years, 7 years. It really depends, and your doctor will tell you about that. The other, the thing that most people dislike about the colonoscopy is that the worst part is the bowel prep. So if some of you may have had one before, you may remember the worst part is the night before when you drink all that liquid in order to evacuate all of the stool. And so that's another thing. Say if you, when the doctor goes in the next day and they look and there's a lot of stool, it's not clean enough, then you may have to come back. So that's another disadvantage that some people may not like. So not only would you have to drink the prep, if it's still not clean, you would have to come back. So there's some details, but for the most part, next slide. What I would say is the best test, or sorry, I guess this is more instructions about the one of the stool tests. So you get this mailed into you, you confirm it's your identification, you get this kind of thing so that when you do have a bowel movement, it doesn't get flushed away. And you get a little sample and then you smear it and then you can send it out to the lab and they'll give you and your doctor the results. And then you can determine whether you need to move on to step 2 if it's positive or you're fine. Another thing that I forgot to mention is if you have a family history of colon cancer, you should probably do the best test available to you, which is the colonoscopy. And then another detail is, say you did a colonoscopy, you found a polyp, and then you're not due for a certain amount of time, you should not go back to a stool test. Once you've found a polyp, you should just stick to the colonoscopy because, again, that's a better test compared to these other stool tests. Okay, next slide. Or slide. So yeah, overall though, any method that you choose to do is better than none. So whichever one, what I tell patients is whichever one you're actually going to do, you're comfortable with, you're not gonna be hesitant and you're not gonna forget, do that one because again, even though colonoscopy is the best one, these stool tests are pretty good. And this is colon cancer is preventable. So we want to make sure everyone is on board, everyone's doing what they can in terms of their part. All right, next slide. Okay, so what can you do specifically aside from, getting a screening test, which is either a stool test or colonoscopy? Another easy, well, maybe not so easy, but one thing that I like to tell patients is stop using tobacco, try to decrease it. I know it's easier said than done, but that's a huge modifiable risk factor. Next slide. And then the next ones that I want to focus more on are exercise. So I think exercise is something we could all use regardless of if we're talking about colon cancer or just overall health. I personally like to kind of simplify things and I'm very visual. So what does it mean when I say you need to exercise? So it's basically just moving around, making sure you're not sedentary. A lot of times now in this day and age, we're driving for like an hour, then we go to work, we're sitting at a table. When we go to meet friends, we're just sitting eating, or maybe we're just really tired, we're just sitting on the couch, things like that. So what you want to try to do is incorporate at least 30 minutes a day of some form of exercise that you enjoy. Aerobics, tennis, gardening, walking. The one note about walking is, say if you, for example, if you're walking with a friend you want to make sure your heart rate is increased and you can still talk to your friend, but you're a little short of breath. So you can't have like you can't discuss full stories and sentences. You may have to pause a little bit. And that means that you're actually working harder. So a brisk walk, 100 steps a minute, that's kind of, obviously you're not going to time it, but that's kind of what I mean when I say you want to make sure you have some sort of moderate activity. Next line, this is not, or next slide, this is not related specifically to colon cancer, but because of this women's seminar, women's health, I really wanted to emphasize the importance of something that I learned early on and I try to incorporate myself, especially as females, as we age, our hormones change, and we're more susceptible to osteoporosis. So bone fractures, losing bone mass, losing muscle strength. So one thing that we should try to do in our daily life is any form of resistance training or some sort of exercise that you, even using your body weight. So what resistance training really means is get these dumbbells that these ladies are holding, use them to, those, that's kind of the weight in order to do certain exercises. You don't have to buy them. You can get like fill up a water bottle, anything that's some sort of weight. And then the other thing is this band from this cartoon. There's basically like an elastic band. It's called a resistance band. As you stretch it, that's kind of what brings that resistance for your muscles to work on. And then these are just some exercises that you can see. So that's just a little side note. I think it's really important to help prevent osteoporosis in ladies, especially as we age. All right, next slide. Going back to colon cancer and how you can help reduce your risk of it. Diet is huge, again, not only just in colon cancer, but in general. And because I like to simplify it, what I like to tell patients is only eat food that will spoil. So colorful food, food that you bought, but within 1 to 2 weeks, it's gonna rot. So that means real food. So you can see fruits, vegetables. Obviously, grains are not going to spoil, but that's the concept that I wanted to impart on everybody. And again, foods that don't necessarily have added sugar, added dyes, preservatives. Nowadays, if you look at nutrition labels, which I do encourage everyone to do, you would see things that you find maybe you think it's healthy, they have 20, 30 ingredients. So what I typically like, an easy way to gauge is, you're buying something, you look in the back, it probably just has like 5 ingredients. And that's an easy way to, it's not for sure way, but that's an easy way to know, okay, maybe it's a bit more natural than all these other highly processed foods. And what does it mean when things are processed? They're just not in their natural state. And I'll talk about that in the next slide too. But in general, those are things that are usually smoked or salted, cured, things of that sort. As you can see in this photo, a lot of like deli meats, pastrami, salami, things like that. And then in general, you also want to try to limit how much red meat you eat. So about 18 ounce in a week. These tennis balls are just kind of helping you with the serving size. So 4 tennis balls, 4.5 ounce per serving. So just to give you an idea that it's, you can't be perfect, but if you make little changes here and there, then that we're looking for a good balance and majority healthy. And then the rest, you try to work on. Next slide. Going more into what exactly is processed food. So if you look in the right, group 4 is the most processed, so ultra processed, so the least natural. So these things, I'm sure, as you can see, Coke, chips, these cupcakes, jelly bean, all these items, they could probably have a long shelf life, right? Like you don't. When's the last time you saw chips rot? Another thing is hot dogs, kind of like what I mentioned, processed meats. Actually, it's hot dogs can be known as a carcinogen. They're very unnatural the way they make them. So I would try to avoid these things. And then as you get more to the left, there's some canned foods. And then group 1 and 2 is what you should, majority of your diet should be and what you should focus on. So again, there's colorful foods, there's fruits and veggies that will rot. There's just, your chicken, eggs. Of course, nowadays, there's pesticides, these kind of things. So it's really hard, but just to get like an overall concept in your mind. So when you're grocery shopping and things of that sort. Next slide. Another visualization that I really like and I think it's important for patients is sugar. So we should also try to limit how much sugar we consume. And so, for example, if you drink a bottle of soda, that's 15 teaspoons, whereas for women, it's the allowed daily amount is 6. And then even a lot of times when we're drinking orange juice and we see it's 100% from concentrate, it's really healthy. It has about 11 teaspoons. So it's important to know there are good sugars and bad, but or I mean natural versus unnatural, but it's just important to know, are you going over your daily allowed intake amount or not? Next slide. And this is a little side note, again, not related to colon cancer, but it is related to all these lifestyle modifications and diet modifications that I'm referring to. Some of you may have heard of something called fatty liver. What is that exactly? So on the left side, we have a normal liver. And then the right side is fatty. So there's fat depositing in the liver. Why does that happen? A lot of times you have some medical conditions like high blood pressure, cholesterol, diabetes, overweight. All those things can contribute in causing fat depositing into the liver. Overall, this isn't a very like dangerous disease, but it's still important to make note of and follow along with how things are going and not take it too lightly, because what can happen is with fatty liver, eventually over the course of years, this can cause scarring in your liver. And then you can ultimately end up with end stage liver disease, which is a really bad, it's called cirrhosis. It's really bad. And so, I'm not here to scare you, obviously, but if your doctor, diagnoses you with fatty liver, what is it that you yourself can do? You should feel empowered that you do have ways to help. So how can you do that? Again, try to exercise daily, move around, try to decrease some weight, and your physician can guide you sometimes depending on how severe it is, 7 to 10% of your body weight. Eat healthy. And then if you have other medical conditions, blood pressure, cholesterol, diabetes, you want to make sure that's controlled. And so that's kind of, again, side note, sorry about that. But going back to our topic. Next slide. All right, so I wouldn't be a gastroenterologist without bringing up fiber. And fiber in general, again, it's not really just particular for colon cancer, but overall gut health. This is really important. What exactly is fiber? So fiber is a type of carbohydrate that you can't, some parts, not all fiber is created equally, but some parts are indigestible. So what happens is when the indigestible parts reach your colon, let me back up a little bit. Your colon, the purpose of the colon is to store water. So, you eat, your upper part of your body kind of digests things and gets the nutrients. And then as it travels further down in the large intestine or colon, the colon is absorbing a lot of water and all the things that are indigestible kind of, come down as well. And then it's a storage for your stool, your bowel movements. So when you're eating this indigestible stuff, it comes into your colon. You have bacteria in all parts of your body, billions and billions of different types. These bacteria then start fermenting that indigestible fiber, and they create all these substrates or like byproducts. So I'm not going to go into like all the science, but they create all these things in order to get energy. And then these byproducts can also help with different things like decreasing inflammation in your colon, keeping the lining of your colon great, increasing diversity of your gut microbiome, helping move things along. So there's not too much contact, or if there's toxins, there's not too much contact in your colon. It's like moving things along. So there's a lot of role that fiber plays in overall gut health as well. And so I do always recommend, again, from dietary, we're talking about vegetables, fruits. You can look at the content of fiber in each thing you eat. And then if you're not able to do it through that, then there are over the counter, natural fibers as well. Next slide. So I wanted to, I think because I mentioned fermentation, that's another topic that I wanted to bring up because this is a common question that I also get asked. Should I take probiotics? What does that mean? So I wanted to first define that terminology. And in order to do that, I wanted to go first to what are prebiotics. So prebiotics, kind of like we talked about, is all the food. So if you eat good food, you get good bacteria. I know it's a very simplistic way, but prebiotics are foods that feed the good bacteria so that they can do their own fermentation, all that, create all these byproducts. And these are, again, you can look at the images, some foods. Of course, it's not limited to just these. Then what is probiotics? Probiotics are good bacteria. So a lot of times when patients are asking me, hey, should I take probiotics? What they're asking me is, should I consume these bacteria? And a lot of time they're referring to the pills that you can see over the counter and things like that. So probiotics don't necessarily have to come in pill form. Obviously, you can also just have it in certain foods that have already been fermented. So I'm sure you guys have heard of kimchi is a great source, kefir is a good source. Sorry, you can go to the next line. There's yogurt and tempeh, things of that sort. So these all already have the good bacteria, and then you can just consume it. And what I typically tell patients when they ask me, should I take probiotics, is it doesn't hurt if you are taking it in a form like a dietary form, but especially, if it doesn't bother you in terms of symptoms and if you enjoy eating them, because when some of these foods get fermented, the taste changes and the taste can be good too. But if you're asking me about certain pills, overall, there's no it's kind of a gray area. So there's only a few diseases where it is recommended. Everything else is kind of like it's not really shown to help. The reason why is because, like I mentioned earlier, we have millions and billions of different types of bacteria. There's a diversity. There's good. There's bad. There's different quantities of that. And so if I create this pill and I give it to you, you have a different type and amount of bacteria compared to someone else. So there's no one pill that fits all. So it's really hard. It's not like a calculation where, hey, you need, a million more of these bacteria. So it doesn't work like that. And we're not there yet. There's still a lot of research happening. So my answer usually is if you feel like it's helping, you don't mind the cost of it, then that's fine. But if you go to a gastroenterologist, typically they would not recommend it, just because it hasn't really shown to help specifically with anything aside from certain only a couple of diseases. Next slide. Just to obviously finish off the definitions, antibiotics, as I'm sure you all know, they're actually ones that kill harmful bacteria. Okay, next slide. Okay, so we're at the end of our presentation. We talked about colon cancer. It's a big deal. It's one of the third most common cancers here in the US. It's preventable, which is amazing. We have the tools, technology to prevent it. And the way we can do that is by screening. So age 45 for everyone. If you have certain family history, then you have a discussion with your doctor. And so you may have to come in earlier. And again, increase your daily exercise, move around. If, say if you're going to the mall, maybe park a little further, maybe take the stairs, just little things you can implement in your daily life to help. And then eat food that's going to rot. So it's not meaning that's not processed. It's things that are more fresh and natural. And then incorporate fiber into your diet. This again, if you can't eat as much, then maybe make a smoothie. If you can't do that, then I'm sure a lot of you have heard of psyllium husk and things of that sort. So every little bit helps. And that's the conclusion of my talk. Thank you.
Thank you, Dr. Kasonali. It was very informative, and really, it's encouraging to know that colon cancer is preventable, and to the point that lifestyle can save lives. So we'll now take questions from audience, and I'm having a very great list of questions, very exciting questions. I will refer to each one of them. I'll try. One question that I have, and we can take the questions afterwards, that how long screening should be done?
Yeah, that's a great question. So typically, like I mentioned, you start at 45 and then you're kind of in the surveillance program depending on what they found and things of that sort. Then if you're around age 75, so 75 to 85 is kind of a discussion area. The reason why is because, say, if we find colon cancer at a later age, what we have to take into account is what are your other health conditions? Would you potentially be a surgical candidate if this is something that's really advanced? What's your life expectancy? Things like that. So starting 75 to 85, it's a discussion with your doctor if you choose to do so. If you've never had a colonoscopy and you're coming to the doctor at 75, then you should probably get at least one. And then, yeah, after that, after 85, it's, there's people that get it, but it's not recommended after that.
Gotcha. So first question from audience is that other than family history, could diet can also be causative factors for colon cancer?
Yeah, I mean, so one of the modifiable risk factors is diet, and that's why we highly emphasize prevention, not only through screening, but diet, exercise, everything you do.
Great. Are invasive tests necessary to screen for diagnosis of colon cancer, or are the blood tests there for that as well?
I'm not sure, like, if there's a clarification of blood tests versus stool tests, and the reason I say that is because I mostly mentioned stool tests,
Mhm.
which are non-invasive compared to the colonoscopy. The blood test, these are things that are still under research so far. Of course, that would be really easy. Only one, and this was just a few months ago, most likely, only one blood test has been FDA approved currently. I don't think it has been adopted as much. It's also very expensive, so I also don't know if insurance covers it. But if this question was specific to stool test, which is not invasive versus colonoscopy, like I mentioned, whichever one you're going to do is better than none. There are certain things, for example, the stool tests are better in detecting if you don't, like if it's negative, then most likely you don't have cancer. But the little detail that, again, I didn't want to get into too much detail, but one thing is there's polyps that are precancerous, then they can be considered advanced polyps, and then it could be cancer. So the stool test is great to say, no, you don't have cancer. But then the colonoscopies, and also depends which stool tests, are a little better to say, no, you don't even have the advanced polyp. So the
Mhm.
colonoscopy is better for that part. So it kind of depends. But like I said, if you're going to do at least one of them, do that. It doesn't matter. You don't have to do the invasive. If you're going to do a stool test, if it's positive, then you have to do the invasive one.
Yeah, it's very important. So is colon cancer mostly a primary cancer, or one can get it as a secondary?
Both. Yeah, honestly, it really depends. There's different pathways for colon cancer. Some of them are more genetic, and another one is a different type of chromosomal abnormality. But also, you can have a different type of cancer, and then it can metastasize also. So it really depends. But what I'm talking about is primary colon cancer.
Right. I know you mentioned the age of 45 for screening. Can colon cancer occur in young adults too?
Um, I think the date we would have to kind of look at the data. It can. I mean, the short answer is sure. And that's why in probably my first slide, what I mentioned is if you have certain symptoms, then it's better to get checked out sooner. At that point, it wouldn't be considered screening because you're having symptoms. But maybe when you go and you do get a colonoscopy, then at that time you may get more information. Is it colon cancer? Is it actually colitis, which is inflammation of your colon? So yeah, it's definitely possible to get it sooner. But the main thing, my recommendation would be if you have certain symptoms, blood in your stool, weight loss, belly pain, then you want to go get it checked out, and possibly your doctor would recommend a colonoscopy at that time.
And speaking of symptoms, can long-term constipation lead to severe disease like colon cancer, or any suggestion to relieve constipation or prevent it?
Constipation itself is not necessarily like a risk factor, but if you don't have adequate fiber, so at least 25 to 30 grams of fiber in your diet you need. And the reasons are because I mentioned fiber can help move the motility, move things around. It can help the bacteria in your stomach create those byproducts that can help inflammation and things of that sort. So constipation itself is not a risk factor, but if you increase fiber, it can reduce your risk. And in terms of constipation, like if you want something natural, again, psyllium husk is something. If you're talking about something more diet related, what we do have studies in this. So what I recommend is at least five prunes a day, at least a couple of kiwis a day. You can look up online. There's like constipation smoothies. You can add some flax seeds, papayas. Again, I would encourage everyone to, if you have certain things that you like eating, just look online about how much fiber content it is. Are you reaching that 25 to 30 gram mark? And then that's a great way. Otherwise, again, psyllium is Metamucil, things like that. You need to take it consistently to help with the constipation.
Yeah. There's an interesting question over here, and this has been asked before as well. That the kind of pickles mostly used in our Asian, South Asian diet that are oil-based, are they considered healthy probiotics?
That's a great question. I wouldn't
It is a
know.
very good
I didn't
question.
even know in our culture we put pickles in oil. I think you achar maybe you referring
Yeah,
to.
yeah, yeah.
Oh, okay. Um, I would imagine maybe because there probably is, salting and that fermentation, but honestly, I don't have the answer.
Yeah,
Sorry.
yeah. I would think probably on the other side because kimchi is more like vinegar based and this
That's
is like
true.
oil based.
Yeah, okay, so
So
it's mostly oil. Okay, then yeah, no.
yeah,
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 okay.
yeah, yeah. Um, so another interesting question that as a gastroenterologist, what do you suggest? What type of cooking oils are safe to use for cooking the Asian foods that require like high temperatures?
Yeah, that's a good question. I feel like every day there's a new oil that's a culprit and it's considered evil. I honestly don't know the answer to that because I mostly stick to olive oil because I don't make like like the Pakistani food, you know?
Yeah.
But yes, the I think one thing to note, which you mentioned, is the boiling point. And
Mhm.
so if depending on what you're making, if obviously if it requires more, then you want to get one that reaches that. So a lot of times avocado oil, basically you want to stay away from like canola and these vegetable oils and things of that sort. If there's certain olive oils that can reach the point you want, then that's probably one of the best that I like to stick to.
Right. Um, and can diverticular found on CT of large like intestine can be a risk factor for colon cancer later in life?
No.
No. Yeah. And the last question we will take is that can you explain a little bit about the type of treatment options available in case of colon cancer?
Yeah, that's actually a great question. So a lot of it, and it ties into what I'm doing right now in fellowship. The reason I moved to New Jersey, it's called advanced endoscopy. So the great things that are up and coming now, and then the kind of technologies we have, you in the past, you had something not super invasive. It hadn't maybe it stuck to the colon wall. It didn't travel anywhere else. But in the past, we didn't have tools, so you may have had to go to surgery and just cut it out. Now with advanced endoscopy, depending again on the type, how much the depth that it's reached in the colon, things of that sort, a GI doctor, specifically advanced endoscopist, can actually remove it. And so, for your purposes, it's kind of like a routine colonoscopy, but we're doing much more. We are able to remove a non-invasive cancer endoscopically in the lumen without cutting you open, without cutting part of your colon, none of that. It would just leave a scar inside. You wouldn't really know. So those are some cool things that are coming out. It's only getting better, and that's kind of partly why I wanted to learn all this. And so it's looking very bright. So that's a great point because I would encourage you guys, depending on where you live in the community, if you get colon cancer and it's not very far advanced, but if someone's recommending, hey, you should go to the surgeon and get your colon removed, I want you guys to remember, well, what if I went to an advanced gastroenterologist? Can they do something for me that's less invasive? So it's a great point.
Yeah, great, great, great. There are a few follow-up questions in relate to that. What is the survival rate for colon cancer?
What I know is with screening, you can reduce your risk of the incidence at least like 60, 75%. Mortality also a little higher than that. I don't remember the percentage off the top of my head, but definitely it's a high amount.
Right. So I think that conclude our questions in the queue. So thank you again. Thank you all the audience. Thank you for Dr. Kasamali for bringing such a topic. I feel like this topic can be ongoing for a limited period of time, and we can talk so many follow-up questions. So thank you for the audience for listening, and thank you, Varda. Over to you again.
Thank you.
Sure. Thank you so much, first of all, Dr. Farah Kasamali. It was a very informative presentation, and the way you explained things and also answered our questions. And thank you so much, Dr. Hadika Batul, for bringing this webinar to us on such an important topic with such an esteemed speaker, and you yourself being a wonderful moderator. I would also like to thank the media team of Imamia Medics International, Sarah Shahzadi, for helping us with the technical aspect of the webinar, and all the Women's Wing team, especially Dr. Humana Kvi, who has throughout the year guided us for and motivated us to keep working and bringing for our audience the most important topics. And inshallah, we will see all of you next year with another lineup of important webinars. And we at Imami Medics International invite you to the IMI Karbala conference, which will be happening this year in December. So see all of you there, and thank you to the audience for joining us today, and thank you to the speaker and moderator. Inshallah, till then, till the next year, take care. See you. Allah Hafiz.
Allah Hafiz. Thank you.